originally diagnosed with something they believed was an adenocarcinoma. They had found it had already spread, and they thought I was diagnosed with pancreatic cancer, possibly even a stomach cancer. So when I came to North Shore, I had a pretty dire diagnosis. That's when I met Dr. Basurka, and at that point we went through the battery of tests, and it turned out I had a germ cell tumor, which in fact was quite treatable. Ironically, I'm a molecular biologist. I've been a cancer biologist for about 10 years, and after that I've worked in the private sector as a medical director, so I came in kind of armed with a lot of knowledge. One of the things I'm very aware of is this idea of molecular diagnostics and finding out more about your tumor at the molecular level. So I came in all guns, firing at Dr. Basurka, and he met me right at the minute. He said, we're going to do that, we're going to do this. He was up on everything, and that's kind of right at that point I knew I'd met the guy that was going to treat me. So I was a little concerned. Everybody says go to the bigger academic centers and things like this. And I had the connections to do so, but because this was close to home, I met Jeff as the first oncologist I met, and it was that interaction that really set me on the course that I knew that I was going to get treated here. Once I was diagnosed with testicular cancer, there's a very kind of set protocol that you go through. A regimen of chemotherapy that's pretty standard, a 21-day regimen of bleomycin, etoposide, and platinum, cisplatin. And I received it 4 cycles, 4 21-day cycles. I'm off of all cancer chemotherapy. I got a clean scan back in January. I continue to follow up every 3 months, look at my blood markers, and so far I'm still clean. If North Shore closed, I'd be devastated. I mean, I can't talk enough about it. I think there's a lot to be said. I'm sure you hear this a lot about being treated close to home. It is important. The quality of life while you're going through this treatment, it needs to be maintained, and having to travel 2 hours, 3 hours, whatever it is, as often as you did. I was coming in 5 days a week. It's just not practical or something that you want to deal with on top of feeling awful to get in the car and drive that long. I just recommend staying close to home. I think that, that's something that you can look into doing. I think it's, everybody just immediately thinks of these big centers, and that's, feels like that's the only way they can get treatment. I think if you do your own research and you have a doctor that's willing to open a dialogue, you start close. You can always change your mind. It's always good to get a second opinion. So I think, the information is what's most important at the onset. And you have to feel comfortable. So that was something that I immediately did when I came here. And I was very ready to go someplace else, but after that first visit, like I said, I knew I was here to stay. So.